Do you feel like your gut has a mind of its own? From bloating and pain to multiple unexpected trips to the bathroom, IBS can feel like it's controlling your life. But it doesn't have to. Stick around because today we're diving into what IBS is, what causes it, and the natural steps you can take to heal your gut. I'm Dr. Jess Bilger, the Health and Beauty Doc. I'm here to simplify your journey to better health and beauty with science-backed tips and natural solutions. If you're new here, don't forget to hit that subscribe button for weekly videos that can help you feel your best inside and out. So what exactly is IBS? IBS, or Irritable Bowel Syndrome, is the most common gastrointestinal disorder, and it represents 30 to 50% of all referrals to gastroenterologists. This chronic condition affects millions of people worldwide, often making day-to-day life complicated, unpredictable, and very frustrating. IBS is a functional gastrointestinal disorder. And unlike conditions like Crohn's or ulcerative colitis, IBS does not cause structural damage to the digestive tract. However, it is associated with a wide range of symptoms, including abdominal pain and cramping, abdominal distension or bloating, fatigue, nausea, anxiety, depression, diarrhea, constipation, or alternation between diarrhea and constipation. I know, it's terrible. Let's talk about what causes or contributes to the development of IBS. While there is not only one specific cause, it is typically the result of an interplay between digestive secretions, bacterial flora imbalances, and dietary factors. One of the biggest contributors to the development of IBS is gut dysbiosis. A healthy, thriving gut microbiome is made up of various types of microorganisms, including bacteria, fungi, and protozoa that have a symbiotic relationship to help the gut metabolize food, maintain the gut barrier lining, enhance immunity, and protect the body from invasion of pathogenic or bad microorganisms. Often people with IBS have what is called dysbiosis, which is an overgrowth or imbalance of good and bad microorganisms in the gut. The presence of dysbiosis in the gut can significantly influence the process of how food moves through your digestive system. An overgrowth or an imbalance of harmful bacteria or insufficient beneficial bacteria can cause reactions in the gut that produce excessive gas, disrupt digestion, and lead to chronic symptoms like bloating, diarrhea, or constipation. IBS can also be linked to connection issues in something called the gut-brain axis. The gut-brain axis is the complex communication network consisting of the nervous system, specifically the vagus nerve, chemical messengers like serotonin, and hormones from the endocrine system. This system sends messages back and forth between the brain and the gut. Disruptions in this communication system anywhere along the way can cause the gut to become hypersensitive, leading to irregular bowel movements, abdominal pain, and bloating. Stress, anxiety, and other psychological factors can also impact this connection. Another common cause of IBS is actually stress and anxiety. Chronic stress impacts the autonomic nervous system, which directly controls digestion. This can result in delayed gut motility, increased inflammation, and heightened sensitivity to pain in the digestive tract. IBS can also be impacted by food sensitivities. Certain foods like dairy, gluten, and high FODMAP foods like onions, garlic, apples, and beans are common culprits for triggering IBS symptoms. These foods can ferment in the gut, leading to large amounts of gas production, which then causes discomfort. Keeping a food diary is often a crucial step in identifying individual food triggers. Lastly, IBS can develop after a gastrointestinal infection, like food poisoning or gastroenteritis. This form of IBS is called post-infectious IBS, and may involve lingering inflammation or changes to the gut lining and microbiome that persist long after the infection resolves. Can you relate to any of these triggers? Share your experience in the comments below. So how is IBS diagnosed? Diagnosing IBS can be tricky because there's no specific test for it. It's often a diagnosis of exclusion, meaning other conditions like inflammatory bowel disease, celiac disease, or infections need to be ruled out first. Here's how it's typically diagnosed. First, we have symptom evaluation. Your doctor will likely ask about your symptoms, how long you've had them, and their severity. IBS is often diagnosed if you've had abdominal pain at least 1 day a week for the past 3 months, along with changes in stool frequency or appearance. Abdominal distension, bloating, cramping, diarrhea, constipation, and relief of pain after having bowel movements are incriminating symptoms of IBS. Because the symptoms of IBS can also be symptoms of more serious diseases, your doctor will likely do a host of tests to ensure that you do not have any of these other conditions. Blood and stool tests can help identify inflammation, infections, imbalances in gut bacteria, or conditions like celiac disease that may mimic IBS. In some cases, a colonoscopy is recommended to rule out conditions like Crohn's disease or ulcerative colitis, or to check for structural abnormalities in the colon. These tests are sometimes essential for excluding serious underlying conditions and narrowing the focus to IBS as the root cause. Now, before I cover various integrative strategies to help fix IBS, please consider liking this video and subscribing to my channel for more videos that break down complex health topics into easy-to-understand tips. It really helps this information reach more people who can benefit from it. Now let's break down the integrative strategies to manage and heal IBS. As with every health condition, it is crucial to address the root causes, not just cover up the symptoms. The first and most important thing to do is to make dietary changes. Food is the most important contributing factor to both developing and healing IBS. So what you eat has to change if you want to truly heal your gut symptoms. Many people find significant relief with a low FODMAP diet or a carnivore diet, as both approaches eliminate fermentable carbohydrates that can trigger bloating, gas, and discomfort. All right, let's take a quick look at the low FODMAP diet. This diet focuses on avoiding foods high in fermentable carbohydrates that feed bacteria in the gut. Foods to avoid include fruits like apples, pears, mangoes, and watermelon. Vegetables like onions, garlic, cauliflower, broccoli, and Brussels sprouts. You also need to avoid grains, which includes anything containing gluten, which is the most common food allergy. You would also want to avoid dairy, the second most common food allergy. Many patients with IBS are sensitive to lactose, and they may not even be aware of it. A low FODMAP diet emphasizes gut-friendly alternatives such as zucchini, spinach, fresh berries, meat, and fish. These foods are easier to digest and help reduce bacterial fermentation, minimizing symptoms. Now let's talk about another dietary strategy, the carnivore diet. For those looking for a simpler and highly effective approach, the carnivore diet eliminates all plant-based foods, carbohydrates, and sugars. This strict elimination diet focuses solely on nutrient-dense animal-based proteins like beef, lamb, fish, and eggs. Due to the lack of carbohydrates and sugar in this diet, harmful bacteria starve and inflammation is drastically and quickly reduced, promoting gut healing. While it may sound counterintuitive, one significant benefit of the carnivore diet is its near total absence of fiber. Many IBS sufferers experience fewer and smaller bowel movements on this diet, as the bioavailability of the food, meaning how efficiently the body absorbs and uses it, results in less waste. This reduction in bowel movement frequency and size can dramatically ease painful symptoms like cramping, bloating, and urgency that are common in IBS. Some variations of the carnivore diet allow small amounts of dairy, but due to the milk sugar content and lactose, it is often best to avoid dairy, especially in the beginning while your gut is healing. By simplifying the digestive process and removing irritants, the carnivore diet provides a straightforward, easy-to-follow pathway to healing the gut naturally. Next, effective stress management is essential to improving the symptoms of IBS. Stress plays a huge role in exacerbating symptoms of IBS due to that pesky gut-brain axis communication system we talked about earlier. Mental stress can trigger the brain to send messages to your gut, often throwing off its groove. Practices like prayer, meditation, deep breathing, or even regular walks can help calm your nervous system and reduce gut sensitivity to mental stress. Another way to improve IBS is to introduce specific probiotics to balance your gut bacteria. Probiotics like Lactobacillus, Bifidobacterium, and Saccharomyces boulardii can help restore a healthy, balanced microbiome. One very effective herbal remedy that helps calm IBS symptoms is enteric-coated peppermint oil, or ECPO capsules. ECPO works by improving the rhythmic contractions of the intestinal tract, helping to regulate gut motility. Additionally, it has a calming effect on the digestive muscles, relieving intestinal spasms and reducing cramping and discomfort. Research has shown that ECPO can significantly improve symptoms like bloating, pain, and gas in IBS patients, making it a safe and natural option for helping to manage symptoms. Because the enteric coating prevents the peppermint oil from being released in the stomach, it ensures that the oil reaches the small and large intestines, where it can have the greatest impact. Next up, exercise and regular physical activity play a vital role in managing IBS by improving gut motility, reducing stress, and promoting overall digestive health. Exercise helps stimulate gut motility, preventing stagnation or immotility in the gut that can lead to discomfort and bloating. Additionally, physical activity lowers stress hormones like cortisol, which can disrupt digestion when elevated. Moderate intensity activities such as walking, swimming, and yoga are beneficial as they are gentle on the body while effectively enhancing gut function and reducing inflammation. Consistency is key. Even 20 to 30 minutes of walking or jogging daily can significantly improve symptoms and contribute to long-term gut health. Last but not least, it is important to identify and eliminate triggers to your IBS. Keep a food and symptom diary to identify which foods or habits worsen your symptoms. Eliminating triggers and replacing them with gut-friendly alternatives can make a big difference. 2/3 of patients with IBS have at least one food intolerance, so identifying and eliminating those food triggers can massively assist in gut healing. So how are you going to attack your IBS symptoms and heal your gut? Are you going to opt for a low FODMAP diet, or maybe dive all the way into the carnivore diet? Let me know in the comments below. If this video helped you understand IBS better or gave you more natural ways to heal and treat it, please give it a thumbs up and share it with someone who might benefit. As always, don't forget to subscribe and turn on notifications so you never miss a video. Thanks for watching, and here's to feeling your best inside and out.